Although the breasts in men are not as functional as they are with women, there are breasts in men, and in fact, there is breast cancer, as we will see later, which can be one of the deadliest because men do not check for lumps or any abnormalities within them. The breasts are mostly muscle, and there is no functional purpose, although the nipples are there because by default, when we were conceived, we were all female. There's also other erogenous zones. We look at the scrotum, testicles, the anus, perineum. We find that all the stimulation of various places can be perceived as sexually exciting and determine what is erogenous to each person. According to the cognitive perspective, what determines that is your brain and what you may have been exposed to. When we look at the abnormal and unusually larger breast in men, or more tissue, we call this gynecomastia. And this is typically a benign breast enlargement. It's as common in all stages of a man's life. It's not something that's associated necessarily with being overweight. Individuals that have gynecomastia may work out a lot, but yet not be able to reduce that. They may have a flat stomach and be very fit, but not from here. This is caused by increased estrogen and decreased testosterone levels, among many other factors. So sometimes this is treated with hormonal treatment, and if that doesn't work, then some men choose to go through a surgery to reduce the excess amount of fat. Again, typically this is benign, and unless the individual is uncomfortable with this in here, even if it is a little bit grown, they may just put on a muscle shirt or something to keep them a little bit tighter and just continue life as usual. We'll be looking at the male puberty and quickly jump on to andropause, which, as stated in the previous module, is the equivalent of menopause in men. The male puberty typically begins at 10 years of age. Women start the process of getting ready for this around the age of 7 and 8. And this is a very interesting process that is the work of various parts of the body, including the hypothalamus, which is a part in our brain that begins to signal to the rest of the endocrine network to start releasing GnRH, which is what we call gonadotropin releasing hormone. You may remember this in here from chapter 5, where we also mentioned that women have this hormone. What this hormone does is that it signals the pituitary gland to release follicle-stimulating hormone and luteinizing hormone. Those hormones were also found in and mentioned in chapter 5. What luteinizing hormone does is that it stimulates testosterone to be produced, and so when you mix luteinizing hormone with testosterone, it gives way to spermatogenesis, which is the sperm production, typically around the age of 12 years of age. You may also remember that girls go through a negative feedback loop that, depending on whether they're pregnant or not, there are some hormones that contribute to the increase of the others, but then that increase inhibits the production of the other hormones, and so it begins to decrease that production. This is seen again in the male reproductive system, and I'll show you how similar it is to that of females. Here we see at the very top the beginning of the feedback loop, negative feedback loop, that is. When the concentration of testosterone increases to a certain level, the release of GnRH is inhibited from the hypothalamus. This causes the inhibition of luteinizing hormone, and this results in decreased testosterone production, which then low testosterone stimulates the production of GnRH, which this causes the increased levels of testosterone. And so we go through this whole process that would eventually result in spermatogenesis, or the development of sperm in boys, typically the ages of 12. When this feedback loop occurs, we start seeing that there are a lot of changes in the boy's body. This is what we call male puberty. And so there's a size increase in many organs and glands, including the testicles, the penis, epididymis, prostate, seminal vesicle, Cowper's glands. All those things that we looked at in the previous module start increasing in size, which basically makes them more likely to prepare them for reproduction. There's also growth spurts that are initiated by testosterone levels. These can be drastic, sometimes 3 to 4 inches with just 2 to 3 months during puberty. And that's what would allow, again, for the growth to occur. For a while, girls may be a little bit taller than their age mates that may be boys, and that is because they mature and develop faster than boys do. The testosterone and the hydrotestosterone, which is basically an androgen hormone that's derivative of testosterone, develops what is called the secondary sex characteristics, and that is the larger muscles and bones, the thicker and tougher skin, the deep voice, the facial hair, increased sex drive, pubic hair, and even the jaw and the shape of the head, which becomes a lot more what we'd call the masculine traits, are a byproduct of these two hormones. We have testosterone and DHT, which is again a derivative of this in here. We also find that the penis grows about a year after the testicles grow. So the increase in size of many of the organs and glands, which would start around the age of 10, and so if the testicles start dropping and increasing in size, say the age of 11, then it'd be a year before the penis starts growing to the level that it will remain as an adult. Just like that, we went through the maturation and getting on to puberty, and now we come to andropause. And that is the time that's similar to menopause, but not so much. Some people have argued that it's not the equivalent because menopause for women may come a little bit more abruptly, although it is gradual. It does happen earlier on in their lives. Andropause is a period of time at climacteric when testosterone levels decrease about 1%, have decreased to a consistent low level. And this decrease begins to occur around 1% per year after the age of 40. Andropause, if it is experienced by some, it is experienced till the 70s and 80s. And the symptoms are so ambiguous that we are not even sure that men experience them. In fact, only about 2% of elderly men report experiencing these symptoms. And the symptoms are decreased spermatogenesis. Question is, who would know that unless you're constantly checking? Thinner ejaculate. You may not necessarily be have the interest to check on a regular basis. So again, who would notice that? Less ejaculatory force. They may not be interested in having kids, so that may not be an issue. Libido decreases. That could have occurred since earlier and for various reasons. So again, who notices that? Fatigue, mood disturbances, decreased strength. All these seem to be symptoms of just being at the 70 or 80-year-old mark. So to associate the symptoms with andropause is really kind of difficult. That's why only about 2% of elderly men have reported this in here. There's a controversy about androgen replacement therapy because although, again, only 2% of elderly men report it, some do want to take care of it if they can reduce the symptoms. And so the increase of replacement therapy, which is a hormone therapy, is been seen in the United States, and there's no evidence that would support the link to prostate cancer. Remember, with women, the hormone replacement therapy that used to be a standard way to deal with menopause is no longer the standard because women are reporting cancer cases with the use of that.